Good morning. Healthy topics with Dr. Aliah. How you doing?
I'm good. How are you? I feel like we haven't talked in forever.
Yeah, spend some time.
It has.
I seen you've been crazy busy. A lot going on, right?
Yeah, a lot of moving parts. Obviously, the holidays, I'm sure for you too. But then all good things, but busy, busy.
Yeah, don't stop. And how's the school going?
School is going very well. We just kind of upped the ante with some help with our social media game. So you'll start to see a little bit of different stuff going out actually starting this week, which will be fun. I've also seen you're having some new and fun faces on your podcast.
Yeah, it's been crazy busy.
Super exciting.
Right. Appreciate it.
Yeah,
Um, so we're gonna break down some more sharp pains, some health concerns, you
let's
know,
do it.
give real life solutions that you can actually use.
I love this.
So Um, so today we're talking about something a lot of people experience but don't always understand: sharp pains, aches, stiffness, and discomfort in the knees and legs, especially as we get older, stay active.
Yes.
Um, do you have any tips or recommendations?
Yeah. So, I tell everybody, and I think we've talked about this before, like no matter what we're talking about in the body, right? Aging happens, but you've got to fight it. You've got to have that daily routine, if not daily, every other day, whatever it is that you enjoy doing, but moving your body. And I know we've talked about this too in other joints. It really is from head to toe. Um, yes, flexibility is important, but even more important is that strength component. And I'm not telling you to go lift your 1 rep max, but moving your body against some resistance is super important, especially when it comes to our lower body, because it's the thing that carries us around all day.
Right. And are these pains typically related to muscles, joints, nerves, or circulation?
So I didn't like this response in PT school, but it does depend. So it depends on what's going on. Each pain, right, if we're going to call it that, should feel different. Your nerve pain should feel different than your circulation type issue that might be going on. Joint pain should feel different, again, than a nerve issue. That nerve issue tends to be that burning, and then even go further, that numbness, tingling. Joint cartilage, anything that provides cushion can give you those sharp, like grabby type pains. So it really does depend kind of what else is going on in the body, but trying to differentiate what is actually causing it will be super helpful.
Good one. And is this a normal part of aging or a sign that something needs attention?
It is a normal part of aging. I don't really ever say to my patients, well, you're 75 years old. I really stay away from saying that to people because, 75 is the new 55. People are living longer. I think people are starting to pay more attention to the thing that gets us around. People take better care of their cars than they do their actual body. But if you start to actually take care of it like it is a car, what you put in is what you get out. Um, at 75, you could and should be moving like you are 55. So sure, yes, wear and tear happens. But again, this is the don't let it take over your life.
Good. And a big concern people have is whether these sharp pains will eventually go away, or is this something they'll experience on and off the rest of their lives?
So pain, so a lot of times people instantly think pain is like red flag sign, right? Pain is your body's way of communicating to you, saying, hey, just pay attention to me, right? And if people really kind of break down how along their path things have probably given them the heads up of something's going awry, and we paid attention to it earlier on, the faster you're going to get it to go away. So I tell everyone, yeah, maybe give it a couple days and see if it can kind of take care of itself. And by take care of itself, I mean, if you have a routine that you are staying active, you are doing flexibility and strength training, Those are the people I'm talking about. If that pain kind of arises, give it that 1 to 2 days and see if it will kind of things may just be a little out of whack. Sometimes, and I don't have any like hard data research, but I have enough clinical experience that when it's cold out, a lot of my patients come in and their joints, things just tend to hurt a little bit more. Nothing big alarming that we need to worry about. It's just, hey, things are a little bit more stiff. So they will go away. You need to address them though. So if we're talking months down the road and you still haven't addressed it, it's going to take a little longer for it to go away. So hop on it quick. That's my tip there.
Right. Got to take care of your body like a car, like you said.
Yeah. Yep.
Stiffness and difficulty stretching the leg. Another common issue, like the stiffness, the legs, the knees, where people feel tightness or pain when trying to fully stretch their leg out. What could be causing that?
So a lot of things. Your body is made up of so much, and that lovely song of everything's connected is actually really true. So sometimes actually people don't realize, they think what they need to do is they have a tight muscle, right? Let's use your hamstring. Hamstring tends to be the most common theme, especially in your lower body, right? I have a tight hamstring. Well, it might not actually be your hamstring muscle. What might actually be going on is you have some stiffness in your sciatic nerve, right? So that nerve actually sits in a covering, and sometimes it gets kind of bound up and it doesn't allow it to glide and slide the way it wants to. So people can stretch their hamstrings till the cows come home, but if you don't actually address some of what might be going on in that nerve stiffness, you're actually not going to see a change. So there's a lot that goes on in the body, not just always thinking that it's a tight muscle. So that's where I tell everybody, your training has to really hit everything. And when I say that, I mean flexibility, mobility, strength. And again, I tell everybody, you don't need to go crazy over it all, but make sure you're doing some cross training in there as well.
Right. And is it stiffness more muscle related or more joint related?
So it depends too. So a lot of times what we tease out in physical therapy, is it the joint causing restriction, right? Is it you can't bend your knee or straighten your knee all the way, but also the muscle could be causing that as well. So that's where our lovely skill comes in, is we actually can tease out having you do different tests to see, is it strictly joint? Is it strictly muscle? Or our favorite, is it both? So it really can be both. It can be one and not the other. So there is ways to kind of tease it out. You have to actually shut the muscle off to really test the joint. So it really can depend on what's going on in that person's body. A lot of times you'll see, if the person tends to be older and lovely arthritis has crept in. So we're talking, some joint stiffness might start. You might see on top of that, that muscle gets tight as well, just for protection. So that's where both come into play.
Difficult could be either or.
Yeah. Yep.
So you got to run some tests and see which one it is, right?
Absolutely. Yeah. So you really want to really tease out if it's just the joint and not the muscle. You really have to shut the muscle down. And when I say shut it down, it really is as simple as letting somebody else move you, not you actually activating the muscle. So there is a few cool ways to kind of just tease out. If you need to tease it out, a lot of times it does end up being both that you need to address.
Right. And for the listeners dealing with this right now, what are some safe and effective things they can do to help reduce knee and leg pain and improve the flexibility?
So anything right now, especially, I'm just going to talk from like a rehab standpoint versus like somebody who's functionally training right now. If somebody's listening, they have lovely knee arthritis, hip arthritis, I tell everybody, get on a bike. Your joints love reciprocation. It actually lubricates that joint. So get on a bike, get those joints moving. Any other, functional movements. And by function, I mean squats, right? I've had people, and this might be kind of funny to people, but I've had people, I'm like, I'll ask them, oh, can you squat? And they're like, no, I can't. And I go, okay, do you get on and off the toilet? They're like, yeah. I'm like, that's a squat. So that's a functional movement where I tell people it carries over into life. So any like sit to stands, again, just getting those muscles activated. And then very small muscles. A lot of us don't, this is for our functional people, like our higher athletes that are training as well. We don't tease out our small muscles. So clamshells are a biggie, getting a band around your knees, working those hips. You'll see a lot of times when I treat people who have knee problems, I'm actually addressing your hips as well. So we want above and below this chain to be nice and strong. And my last tidbit, which a lot of people miss, you need to look at your ankle range of motion. If you don't have really good ankle range of motion, you're going to start making up for it at your knees and hips. So that's actually a really good place for people to start, is actually checking out that ankle range of motion.
Good one. And I know you're big on like routines. Are there any morning or bedtime tips you could recommend to help keep the legs and knees loose, supported, and pain-free?
So I would tell you, and I think we talked about this, right? Like getting up, getting out in the morning, get that walk in. It doesn't have to be crazy, 10, 20 minutes. And I know it's colder for some people, especially us up in the Northeast right now and just got hammered with that snow. Even getting on a treadmill, just getting your body loose would be great. I always tell people, if you're going to stretch, and when I say stretch, like static stretching, doing some sort of yoga at the end of your day because you're nice and warm and you've moved your body pretty much all day. Another biggie that I started doing at night for any type of cramps that may happen is some magnesium at night. It actually helps sleep too. So that's a biggie, like just a supplement that I probably personally would recommend, if not anything else.
All right, it's a good one. And do things like hydration, sleep position, or gentle mobility make a difference?
Yes, absolutely. So sleep, again, you and I will talk for months and I will echo sleep till the cows come home to people. Please make sure you are having good sleep hygiene, right? Going to bed at the same time, around the same time every night, getting up. It's really important. That's the only real time our body rests and can heal. As far as sleep position, so when I turned 30, I realized I don't love when I sleep on my side that my knees touch anymore. But if my patients come in with back or hip pain, I'm also telling them to put a pillow in between their knees. So all it does is, if you can imagine gravity, instead of your hip pushing it down like this, it just evens it out. So you don't have any extra tension along that hip. And not even just your hip, your knee, your back, it just pulls everything down. So if you are a side sleeper, putting that pillow in between that knees can actually just assist with some of that sleeping position.
Good. That's a good one.
Yeah.
Like a professional help reminder from you, when they know when pain is normal versus when it's like, oh, I gotta go see a professional.
Yeah, great question. Anything really sharp that came on, staying sharp, you're not able to put weight on it. You're not able to actually walk through it, walk on it. Something that's lasting, I would say 4 to 5 days. I always tell my patients, you know your body best. You're with it 24/7. So if something seems off and it's gone 48, 72 hours, don't be afraid to go get it checked out. Again, I'm going to echo what I said earlier. Jumping on it faster is better. That's, again, I'm not saying raising red flags right away if we have a tweak here and there. But again, you know your body best. You know when something is like, this doesn't seem like it's getting better. If anything, it's getting worse. So again, listen to your body. It tells you, it communicates with you. But I wouldn't let it go any more than 3 to 4 days if you really feel like it's not improving at all. Keeping you up at night is another biggie. That's a one that I would say to you. Your first night, probably going to be uncomfortable, but if it's continuing to keep you up at night, that's another big one that I would say probably get it checked out.
All right, good one. Well, this has been another powerful conversation on healthy topics. A big thank you to Dr. Aliah for breaking this down and giving us steps to take better care of our knees and legs. Take care of your body like a car.
Love it.
And for the people that's going to see this, can you tell them where to sign up for your school?
Yeah, so head on over to our Instagram page. The link is in the bio. Our big niche is dizziness and vestibular, but inside our school, we have every joint from head to toe, 90-day rehab plan for you as well. So please come over. We offer bonuses in there and have our own little community. So we're excited for you to come join us on this healing and preventative journey. Remember, link is in that bio.
Yes, so go sign up now. And appreciate it again, Dr. Aliah, and I'll see you next episode.
Absolutely. Thank you so much.
All right, take care.
Bye.